Hey, it's Dr. Trish Leigh with another neurofeedback question for me to answer. Today's question surrounds the challenge of sexual addiction. So there's many therapists out there that work with people who struggle with sexual addiction. And I help those therapists think about how they can incorporate neurofeedback into their practice. So that's what I want to talk about today. And if you are someone who suffers with sexual addiction, then this information is going to be really important and salient for you too. So let's just dive in. Okay. Now, the first thing that I need to communicate is that sexual addiction is not about sex at all. And you probably already know that if you are involved in this field or if you struggle from the challenge yourself. What it does involve is a brain pattern that's at the source that is creating the compulsive feelings to either watch porn or engage in sexual activity, or especially to engage in risky sexual activities. And if you're in a relationship, that might mean doing things outside of that relationship. The whole point is that there is literally a neurological brain pattern that's at the core of that challenge, and it's driving those compulsive behaviors. So it goes something like this. The area in the middle of the frontal lobe of the brain right here is called the anterior cingulate gyrus. When someone really suffers from a sexual addiction, typically that area of the brain is on fire. And what I mean by that is it's using an overactive brain pattern. It typically is a brain pattern that has excessive slowing, which is too much use of extra slow and slow brain speed. And so in this regard, if the brain's running too slow, it's looking for stimulation to keep it awake and alert and engaged, because basically those extra slow and slow modes are making the brain fall asleep. So that brain is looking for stimulation, and it's doing it in a sexual manner. And we'll get to why that might be the case in just a minute. Then there's also a pattern of excessive fast brain speed. And so many times these two patterns go together. And what that causes is anxiety, it creates hypervigilance, but it also creates obsessive thoughts and constant thinking, which drives the need for compulsive behaviors to help that brain feel better and to feel calmer. So what this might look like in someone's life is something's driving this too slow and too fast pattern, and then they have all these compulsive thoughts about sex, but generally it's not even driven by sex. It's driven by some other stressor or something traumatic that's happened in someone's past. Many times it can be financially driven. So if people are worried and stressed out about money, then that release, the sexual release, becomes a way of them getting out of their heads in terms of money. Money might just be one example, but there could be other examples that is a driving force underneath that really has nothing to do with sex at all. Sex is just the outlet, like drugs might be in a drug addiction, like alcohol might be in an alcohol addiction. They're similar, but not exactly the same. So back to what might be causing this, and science shows that when people struggle with sexual addiction, many times it is in order to create and perpetuate for the person a guilt and shame cycle. So if something happened in their past, and many times it has to do with nurturing and not having a nurturing environment when they're young, and that created a cycle of feeling guilty and then feeling shameful, by continuing to engage in these sexual activities, it keeps the person feeling guilty and shameful. So like, especially in regard to watching porn, when someone watches porn, the buildup to that is actually what the brain wants. Sexual release isn't actually the goal. The goal is the feeling and the stimulation that the brain wants and the anxiety that the brain wants surrounding the activities building up to that moment. And then actually the moment of sexual release is a letdown because all of that buildup is now over. And then usually a person will feel guilty and shameful after that. And self-awareness might not be there, so the person may not know it. But My point is that there's a brain pattern that's driving it and perpetuating. So bringing us to the role of neurofeedback in helping people with sexual addiction, the role neurofeedback plays is it calms the brain down. So what it does is it will decrease that excessive slow speed, decrease that excessive fast speed, and many times it's right up here, but it can be the whole frontal lobe too. Many times when we decrease all of that activity, the brain is much calmer and it doesn't feel the need to engage in those compulsive behaviors. The compulsiveness of needing to engage is no longer there. And that's when therapy can really be so fruitful, when the therapist gives the person techniques and strategies now to overcome those desires, because the desire itself has been lessened. And now the brain is able to learn how to engage with the world more appropriately. And then if there is anything in there that needs to be dealt with in terms of trauma from the past or rebuilding self-esteem and those types of things, that can be worked on because the brain is in a better spot. Okay, so I hope that answer helps you think about the role neurofeedback can play in sexual addictions, because I believe that it really is a fundamental to helping people reboot their lives, reboot their relationships, and get back on track in a really healthy way. Okay, so remember, control your brain or it will control you. Thanks.